vehicle emissions are a challenge in the city of Johannesburg. They actually are counted as the second highest contributor for our PM10 and PM2.5, and also the highest contributor in terms of our NOxes.
Air pollution exposure has dire impacts on the respiratory system, ranging from asthma, both in children and adults, as well as things like chronic obstructive pulmonary disorder, and exacerbates TB, crosses into the blood and can traverse to any organ in the body, especially the brain.
The TRUE initiative has undertaken the first ever roadside remote sensing emissions testing in the African region. As part of the study, we've collected over 250,000 measurements. We've looked into NOx, particulate matter, carbon monoxide, hydrocarbons, and also ammonia. Minibus taxis made up 10% of vehicle activity in the central and southern regions of Johannesburg, but they made a disproportionate amount of emissions, up to 40%. Diesel minibus taxis are increasingly replacing petrol minibus taxis in Johannesburg. They made up only around 7% 25 years ago, but now diesel-powered minibus taxis make up 98%. If you compare diesel minibus taxis that we've measured, they emitted significantly more NOx and PM emissions than their petrol counterparts.
Residents in Johannesburg are very worried about the poor air quality in the city. 90% of the residents actually cited that they were concerned about air quality. The city had already committed towards addressing or working within the transport sector, so this became an opportunity to give them the data that they needed. Commitments to policies such as the clean air zones demonstrate that the city is willing and is wanting to actually address poor air quality.
Based on our findings, we've suggested policy recommendations for Johannesburg and also for South Africa. The TRUE's recommendations to establish clean air zones in central and southern parts of Johannesburg, where we saw the highest emissions, be more ambitious and deploy more electric buses and also minibus taxis, and update the inspection and maintenance program to reduce emissions from the highest emitting vehicle groups. Also shift to different modes of mobility like cycling and walking. And on the national level, emission standard in South Africa lags significantly behind comparable economies in the world. We recommend that South Africa adopts Euro 6D emission standard to reduce emissions consistently from all vehicle segments and also to safeguard against emission deterioration.
I think people need to understand that clean air is a human right and something, as a citizen of South Africa, you should demand the ability to breathe clean air.
The work that has been done through the TRUE emissions program is very important. We will be able to use these findings of the study to improve how we manage air quality to protect the health and well-being of our communities.